Hello. This is a video discussing a lesser-known symptom of schizophrenia or schizoaffective disorder, referred to as self-isolation. Now, that's pretty straightforward, and we can think of many reasons why someone with this disorder would self-isolate. First, we think about paranoia. Naturally, what comes to mind. This can cross over into delusions, making someone feel like they're crazy, or like people in society will view them as crazy if they, go out and someone asks them how they're doing and they have to tell them, about this certain delusion they might be having. Of course, to the person, this seems very real, and that's where the problem comes. Another reason we could think that someone with schizophrenia would self-isolate is because that they are anxious or nervous about social interactions. Whether it is because they have tics or because they can't stop and realize someone is joking in the moment. Maybe because a person is having some sensory issues that day, causing them to be anxious about social interactions, all the talking, all the noise of going out, or just multiple people in one setting. This could be stressful or overwhelming for a schizophrenic. Let's see. Another reason someone would self-isolate is because they are depressed. They don't have the energy to go out. They don't have the energy to have social interactions or to go and dance or go out to eat or whatever. So lack of energy and depression. Then you might see another reason being substance abuse. Someone wanting to just be cooped up, getting high all day. I have a video up about substance abuse in schizophrenia, and it is at a 50 to 60% higher ratio than the normal population. We see schizophrenics abusing substances, which I believe it's 1 out of 2 or 1 out of 3, 1 out of 2 people with the disorder has a substance abuse problem. Coexisting with their schizophrenia. Now, another reason someone would self-isolate is because they actually don't have many people that are accepting of them, so they don't have friends to go out with. This is a very sad reality. A lot of people with this disorder are viewed as socially inept or weird, quote unquote, odd, queer, however you want to say it. And this can cause someone to be very self-conscious, possibly even giving them a distorted self-image, otherwise known as I believe it's dysmorphia. That could be a reason why someone wouldn't want to go outside, is they look in the mirror and they think they look atrocious when in reality they look fine. But to them, their head might look extra big, or their eyes look extra small. Skin looks extra wrinkly when it's not, things like that. Then, of course, we see hallucinations, visual hallucinations, as something very stressful, something very almost traumatizing in certain patients. Some patients are very sadly, they're used to it, so it doesn't seem to traumatize them anymore. But other people that don't have them often get a visual hallucination, they may not want to leave their room for 3 or 4 days because they're so freaked out about what happened. Now we look at the negative side effects of socially isolating, and one of them is lack of interaction with others. Can lead to a person getting more and more inside their own head. Psychologically speaking, you need other people around you to give yourself a distraction from the self. And a symptom of schizophrenia is a distorted self-image, distorted perception of the self. So this is a big reason as to why people with schizophrenia need to be out and at least having some social interaction, communicating with friends, have some kind of a job. Of course, this is a lot to ask, so people do the best that they can. But there are many reasons as to why it's important. Another being, of course, exposure to sunlight. Someone stays cooped up inside all day, they're not getting any sun. That's pretty bad for your health. As we know, we need sunlight to grow and flourish. Let's see. Another symptom of self-isolation could be increased drug use. Someone is paranoid. They don't want to go out. They have nothing to do all day besides their drugs, you know? And another reason someone might actually self-isolate, a little backtracking here, is their medication is wearing them out, and they don't have any energy from their high dose of antipsychotics or their benzos, or, their antidepressants affect them in a certain way, or the mood stabilizers make them tired, things like this. But it's very important for these people to get out and be active, socially active, and a part of their community. Myself included, of course. I have the disorder, and I do tend to self-isolate. I know I shouldn't. I do try to hang out with my friends at least once or twice a week. It just depends on the mood. Some days it's, I'm hanging out with 2 different people every day, But other times I just don't have the energy, or I'm in an odd state of mind. I don't want to freak anybody out. That's another reason someone might self-isolate, is they're experiencing this symptom known as word salad. This is when you can't communicate. You can't communicate the thoughts in your head properly, and the words you say are loosely tied together, but they don't really make sense as a sentence. That, or forming a proper sentence followed by a sentence that has nothing to do with the latter. So you might not have completely disjumbled speech, but I could say, I miss my grandmother. Where are we going? In the span of about a second break in there, and maybe add on 3 or 4 different sentences. I miss my grandmother. Where are we going? What's for supper? Oh shit, I'm hungry. The hungry and the supper are loosely tied together, of course, but the fact that there's no time in there to wait for a response, the fact that the sentences don't form a proper paragraph put together like that, that is what word salad is. And this could be very disorienting for a person and make them not want to go be seen as someone weird or go outside and cause a scene. So that's, I'm trying to think if there's anything else. I'm sure you could find more on the internet, but as far as my notes go, that's pretty much everything we got for self-isolation. If you have any of these symptoms, or you're experiencing more symptoms, I would recommend you go talk to a doctor or your physician. Or your psychologist. And always remember that it's nobody's fault that they're having these symptoms. It's just the way that it goes sometimes. So if your schizophrenic friend is ignoring you, or he's not hanging out, or he's being, what's the word I'm looking for here? Being flaky, it may just be because he's experiencing some symptoms and he's not comfortable being around people in the moment. So hopefully I could shed a light on a few things with this video. Hope you guys learned something. If you have anything else to let me know, you can comment it. I'm always looking for comments. So otherwise, have a good day. And I'm going to be making my next video about, what was it? Damn it, I can't remember. Well, I guess it's a surprise. I'm sorry. Have a good one.